My name's Josephine James and I'm 90 years old. And yeah, for the last 2 years I've had the nurses coming twice a week just to dress my legs. It's always booked for twice. It's always been booked for twice a week. And if Dot can come, she'll come. Other nurses come, but Dot will come quite frequently. And then she'll sit down and she takes all the dressings off very gently. And sometimes she's got this water in a plastic bottle. They used to had to wet it so they could get the back. That's how bad it was, and all it was bleeding, wasn't it? We couldn't stop the bleeding on one leg because I used to joke, you're gonna have to give your blood transfusion before long. Because of my bad circulation, the blood should come up and feed the skin or something, and it doesn't, so the skin breaks up, or it turns infected. But it's very, very sore. But then she would just decide what dressing to put on. She said, all right, this is not working, we'll try this. This is not working, we've got to try this. And eventually she tried that bandage, the last one, the cold one. That did it. Because as it flared up again recently, all the skin had gone off the top around my ankle. And she came and put that on for me. It came about 4 days later. It was gone. It was better. Didn't need another dressing. And I can't explain how you feel when that happens. And then once I got cleared, I've had 3 months. She cleared it up. They cleared up, these nurses. I never thought I'd see the end of it. But then it's all started up on this leg, on the left ankle now. And I felt so down at first. You just lose the will to live sometimes because you can't do anything because your legs are hurting all the time. It's like you drained all the energy from you. You're coping with the discomfort all the time. And not sleeping at night. I was getting up 3 o'clock in the morning because it hurt, and sitting in the chair and getting on the iPad from it. I'd do my puzzles or I'd read because I couldn't sleep with the discomfort. I don't know what I'd do without Dot and her team of nurses. Believe you me, I can't speak highly enough about them.
My name's Dot Day. I've been working with the District Nursing Service in this area since 2004. My role is a special interest in tissue viability, and that gives me better scope to be able to make decisions, to use my knowledge and to liaise with other people. So with Joe here, I was able to, very quickly get into the leg ulcer pathway and very quickly do the Doppler, as in some other people might have been, especially at that time when it was COVID. There was a lot of redeployment. There was a lot of people that nurses that would be good at doing the dressings, but not at knowing the pathways and doing changes of procedures and what topical dressings. But my team find it helpful to be able to come to me. They know who they can ask, and if I'm not on duty, they can task me or email me, and I can look at that another time. So a lot of the patients that they're struggling with wounds, then I'm allocated time to go and look at those wounds. I've got time to research back into their notes and what's going on. And if it's still not improving, we can refer still to the whole tissue viability service. For instance, with Jo, because she had plantar fasciitis and at that stage we couldn't bandage the feet, we were able to think we can adapt it and go outside, which other nurses wouldn't be able to feel confident to do. And then once we've decided that one, they can follow it, and the other nurses, if there's a problem, they know who to come to. Because all of our nurses and all of our HCAs in this service know a lot about wound care, but it's they're not non-healing, the problematic or the out of the ordinary type of wounds that we need help with. And the same with not all the doctors, but some of the doctors, knowing that there's someone of my position in the team, then that makes them feel reassured. They do want to know that the tissue viability service as a whole is involved in the patient's care.